you very much, Mr Stewart, and it is a pleasure to serve under your chairmanship this afternoon, and I want to thank the honourable member for Colne Valley for their role in securing this vital debate, and to all members for their contributions. As we've heard on a number of occasions today, Parkinson's affects 153,000 people in the UK, and more shockingly, every hour 2 more people are diagnosed. For me, this issue is personal. A close family member was initially diagnosed and treated for Parkinson's. More recently, that diagnosis was revised to progressive supranuclear palsy, a rarer and more aggressive condition. This journey from uncertainty to diagnosis and then living with a progressive neurological condition has profoundly impacted me. I've witnessed firsthand the critical importance of early diagnosis, emotional support, specialist care, and above all, hope. Last month, ahead of World Parkinson's Day, I met Parkinson's UK and individuals affected by the condition. I heard powerful accounts from volunteers about the daily challenges they face with mobility issues, speech difficulties, and the emotional toll on themselves and their families. I will continue to commend Parkinson's UK for their tireless work, both across my constituency of Farnham, Borden, Haslemere, Liphook and its surrounding villages, and across the country, providing advice, support and advocacy at every stage of the Parkinson's journey. However, to date, I am concerned with the Labour government that the Labour government has yet to identify Parkinson's as a strategic priority. So can the Minister confirm what level of funding is being allocated to Parkinson's research this year and how this compares to the past 5 years? During my tenure at the NHS Getting It Right First Time programme, I was involved in the publication of the Neurology National Specialty Report. This analysis highlighted significant variation in neurological services across England, particularly in managing conditions like Parkinson's disease. The recommendations in these reports are essential to reducing disparities and improving outcomes. So can the Minister today commit to addressing the priorities in that report in detail beyond general references to cutting waiting lists? Under the previous government, Mr Stewart, the Conservative government, we invested more than £79 million in research into Parkinson's between 2019 and 2024. And in 2022-23, the National Institute for Health and Care Research enabled 114 studies related to Parkinson's through its infrastructure. We also rolled out a new treatment for advanced Parkinson's disease through the NHS starting in February of last year, offering an additional option for patients whose symptoms were no longer responding to oral medication. So I'd be grateful to the Minister if he can confirm that the government plans to continue this momentum, what research funding will be maintained or increased, and what new treatment options are being supported or explored. The new government has committed to updating the last Conservative government's long-term workforce plan. When will they announce what level of detail and what specialist training there will be for Parkinson's nurses and clinicians? And will they maintain the focus on specialist care? Charities such as Parkinson's UK do an amazing job, but like many other sectors, they are having to respond to higher taxes and squeezed funding. So will the Minister outline how he is talking to the charitable sector to ensure that changes that the government is making in the budget are not damaging Parkinson's care? Finally, what guarantees can the Minister offer that the recent restructuring of NHS England will not worsen access to Parkinson's services? With 50% cuts to integrated care boards, can the Minister reassure people that Parkinson's sufferers and their families will not be disadvantaged? I know that members from across the House are united in wanting to improve treatment, support and outcomes for people with Parkinson's. In a response to a debate I spoke in earlier this month, the Public Health Minister said she'd be happy to meet with stakeholder organisations to discuss the Parky Charter and the progress of Parkinson's Connect pilots. I'd be grateful if the Minister could outline whether the Public Health Minister has arranged these meetings, and if not, when they might happen. A meeting would prove the government's action, or would prove that the government has action on workforce, waiting times, integration, support for carers and access to research and innovation. My colleagues and I in the Conservative Party stand ready to work constructively with the government and with members from all parties to ensure that progress is not only protected but accelerated. Mr Stewart, let us match awareness with action, for only with action will there be hope.